There we go. Okay, thank you. Thank you all for having me here. I'm very happy to be here. I'm going to be going over just a little bit about Life with Cancer, the program we have here at Inova, and how we provide the multidisciplinary and integrative approach, and then I'll go a little bit more broad from there. This is our beautiful family center that we have that houses a large portion of our Life with Cancer program. The purpose of our program is to enhance the quality of life to those who are affected by cancer and provide evidence-based education, support, wellness programs, and integrative practices. We are a unique model. We are a program of the Inova Cancer Institute. We're funded by the community through donations, planned gifts, and fundraisers. We are available at multiple locations. So our beautiful family center that you just saw, as well as we have staff placed into 4 hospitals and our outpatient Inova Cancer Center. And so we offer both inpatient and outpatient supportive services. Our services are offered throughout the cancer continuum. So starting at diagnosis, throughout treatment, into survivorship. Should there be any recurrences, we're there for that, as well as support for family members in bereavement. Our resources are free, regardless of where you get treatment. So the patients that get our services through Life with Cancer do not have to be patients of the Inova Cancer Institute. We are located in Fairfax, Virginia, so anybody that gets treatment in our general area can come to our family center and get our support. And it's available to patients, survivors, caregivers, which includes friends and family. And we also have programs for children and teens, both who are diagnosed, but also those who are children or teens of a parent or a grandparent or a friend who is diagnosed. And we're staffed by a large interdisciplinary team that includes oncology clinical therapists, which are social workers and counselors, oncology nurse navigators, oncology dietitians. We have an oncology certified exercise therapist, psycho-oncologist, Dr. Lolak, who just spoke, as well as our administrative team, acupuncturists, massage therapists, and Reiki masters. We are an evidence-based program. We're comprehensive, and evidence-based is very important to us. We including individual appointments with our navigators, with our therapists, and our dietitians. We offer classes that are educational, movement-based or stress reduction, like Dr. Lilek spoke about. Educational is going to be more of those lectures and talks to talk about, for example, nutrition or side effect management, brain fog, etc. Our movement can include yoga, tai chi, Zumba, pickleball, and anything in between. And then our stress reduction, art therapy, meditation, energy therapies like Reiki or healing touch, writing, knitting, etc. We have over 200 classes and programs a month that we're very proud to support our patients. Oh. So why are we offering all of these different programs, both in and outside of the treatment center? And it's because cancer impacts every part of somebody's life and their family members, from physical symptoms to family relationships. The role that you play within your family can change, spiritual questions, emotional support needs, work, fatigue, memory and concentration or cognition, finances, legal, etc. So we want to make sure that we're providing support on every level to our patients. So the NIH, the Comprehensive and the National Center for Complementary and Integrative Health, talks about integrative care as it often brings conventional and complementary approaches together. So that's chemo, radiation, immunotherapy, but also Reiki, acupuncture, talk therapy, and many others together to both inside and outside of the treatment centers in coordination to provide care to the whole person. And so these include mental, emotional, functional, spiritual, social, and community aspects of care. So it's all encompassing to provide care to the whole person. And the goal of this is to improve quality of life and make sure that every aspect of a person's life is cared for. So looking at the treatment centers, what could you see, whether that's here at our center or in your own, for integrative or multidisciplinary care? So of course, there's the care provided by your oncology physicians, including your medical oncologists, your radiation oncologists, your surgeons, your advanced practitioners, et cetera, both in and outpatient. But there's many others, as you can see listed here, that you might also find within your treatment centers. Your oncology nurses can serve in many different roles. It really depends on their experience, their education, any specializations that they have, and then the role that the center chooses for them to be in. Some of those can include giving a physical exam, administering chemotherapy or other medications, identifying patient needs, coordinating care with other members of the oncology team, education, and performing research. We have the palliative care team, which works really closely with the other oncology teams. And their goal is to prevent or treat symptoms and side effects both of cancer and of cancer treatments. They're especially helpful if we're having difficulty within the traditional oncology team to care for symptoms that you're having, that if we're not able to manage those, that palliative care team can step in and help specialize in that management. Our nutrition is typically offered by registered dietitians, and the registered dietitians can provide education on eating well and general nutrition, as well as special recommendations to help those that are dealing with cancer cope with their dietary needs. In some cases, they can also provide medical nutrition therapy. We have case managers, often seen as social workers or nurses in this role. They provide logistical support to our patients and families. Some supportive resources that they can provide can include financial resources, housing assistance, insurance navigation, helping with disability paperwork, advanced directives, facilitating home help. So whether that's home health organization and nurses and certified nursing aides, or rehabilitation, so physical or occupational therapy or speech therapy at home. If you need any durable medical equipment like a wheelchair, a walker, a hospital bed, etc. They sometimes can help with transportation and then other logistical or practical needs. In the inpatient setting, they're often helping with discharge planning. We have oncology counseling, so it's offered typically by a social worker, a licensed counselor, or an art therapist. And this touches on much of what Dr. Lolak was talking about, helping people cope with the cancer and the challenges that this can bring emotionally. They can also lead support groups or classes and help people find other supportive resources within the community or nationally. Spiritual care often offered by a chaplain. And they offer spiritual support or spiritual rituals for people with cancer and their families. They may also lead some support groups. Most hospitals will have a chaplain or a clergy on staff that work with people of all faiths. Rehabilitation therapy is the physical therapists, occupational therapists, speech and language pathologists. They often help people with cancer return to their highest level of functioning. For example, they can help people learn exercises to regain strength after surgery. So that's just one example. And then patient navigation. They help guide people from diagnosis through survivorship. A patient navigator can help a person find counseling, financial help, or other support services. For example, if you don't have a case manager, but you do have a patient navigation, sometimes those can overlap. They can also help coordinate appointments and help communicate between yourself and your physicians or medical team. And they're very valuable, helpful part of the team. They can be nurses, they could be social workers or volunteers. It really depends on your institution. And the role of integrative care in the community. This is where we're seeing a lot of that supportive care, some of what Dr. Lolak had touched on. So peer support. This allows for a connection with others who get it. I want to make a little note about groups. Oftentimes I've heard from people feeling a little weary about going into groups, worried it will be really depressing or feel like a pity party. And although people do sometimes bring their struggles to talk about in group, they also provide a wonderful community of support, allowing space for sharing both difficult and positive news, and just a space to support others. Many people have reported feeling a sense of community in their support groups that enjoy laughter as well as sometimes tears. Groups also provide multiple perspectives, and they share common themes that many people experience regarding cancer, which can help reduce isolation. The individual peer-to-peer support allows a space for you to talk with one other person who has been through a similar diagnosis, usually on the other side of that, and treatment similar to you. And so they can share their experience, which can help validate and normalize yours, or give you ideas or questions to bring back to your medical team. Educational classes can vary from specific disease types and treatment modalities to general nutrition and cancer classes, to education on benefits of stress reduction, to talking about insurance and finances, etc. What their goal is to allow your knowledge to expand specifically on your cancer or your treatment options, benefits, and coping styles and techniques. They have added benefit of meeting others who are either going through similar experience or are interested in similar topics and coping with cancer. Movement and exercise. Dr. Lolak talked on how this can really impact your emotional health. Many centers will offer movement such as yoga or other classes to their patients, and oftentimes it can be free of charge if it's through your cancer center or through a supportive program in your area. Engaging in movement is not only good for your physical health, but as Dr. Lolak said, can be very helpful for your emotional health. For stress reduction and mind-body, these can be very similar. So some of these techniques can be placed in both categories, things like mindfulness, meditation, progressive muscle relaxation, visualization, and other techniques that involve your mind and body, but also allow you the space to reduce stress or relax. Some of those other stress reduction techniques, we often recommend people to look at what has helped in the past, what has helped you deal with stressful situations before. And in addition to that, looking at journaling, energy therapies, engaging in activities that you enjoy or distractions like Dr. Lolak talked about, art making, knitting, spending time with family or friends, going to the movies, etc. And then in addition to this, acupuncture, massage, and spiritual engagement. Mind-body can be very helpful for stress and overall physical and emotional well-being. Yoga, Tai Chi, Qigong, breath work, meditation, those are some of the most common techniques that would fall into this category. And then lastly, therapy and psychiatry, which of course Dr. Lolak has touched on.